We learned a lot over the last decade in myelofibrosis and stem cell transplantation, especially with the new drugs that came into play with the JAK inhibitors, but also now the combination therapies. We learned more about the patient selection, especially when it comes to molecular monitoring, but also molecular risk stratification. And what we learned is that we can individualize the transplant platform by reducing the spleen size, especially before stem cell transplantation, to get excellent outcomes for engraftment and low relapse incidence, to improve the overall survival of our patients, but much more importantly, the non-relapse mortality, to reduce the non-relapse mortality early after stem cell transplantation. And this very challenging cohort is the biggest key point we have to address. One thing that we learned from multiple studies is that there is no difference in the conditioning intensity for patients with myelofibrosis. However, what is much more important is the spleen size before stem cell transplantation. So to reduce the spleen size before stem cell transplantation is a very big factor for better outcomes. So what we learned over the past years is that the introduction of splenic irradiation as part of the conditioning regimen is very effective in reducing the spleen size already before stem cell transplantation, resulting in better outcomes compared to patients with splenectomy or no other treatment. So we would recommend to not do any splenectomy, but splenic irradiation in patients with massive splenomegaly. One big factor that we still cannot minimize enough is non-relapse mortality. So despite our better selection and therefore also improved outcomes over a recent decade, is that the non-relapse mortality still is very high in patients with myelofibrosis. One thing obviously is patient selection, but the other thing that we need to improve with is the treatment itself. So we need to find strategies that are similarly effective than a stem cell transplantation, but less intensive. So this is the key point we have to address.